Good afternoon, everyone. I want to express my deepest condolences to the family and friends of the person whose COVID-related death has sadly been reported today. The COVID-19 dashboard today reports a further 97 positive cases. We still have work to do on combating this virus, and while we must never be complacent, it is undoubtedly the case that very significant progress has been made. This is a suitable time to pay tribute to the collective determination of all the people across Northern Ireland. We have maintained and observed effective restrictions from Boxing Day until Easter. That has required remarkable commitment and incredible sacrifices. Many lives have been saved as a result. Intolerable pressures have been lifted from our health service. And now we can step cautiously into a new environment. The scales are tipping in favour of relaxations of some of our restrictions and being able to accelerate that process. This is thanks in no small measure to how you have all stuck with the restrictions and the progress of our vaccination programme. The restrictions have taken a very serious toll on all our mental and physical health, on individuals, on families and on communities. COVID fatigue risks itself mutating into COVID despair. Frustration is growing, and if unchecked, it may impact on adherence with public health advice. I don't want to see that. The people working on our health service don't want to see that, as we know the consequences. We must avoid that, because continuing to follow that advice will allow us all to do more. I believe that the time is now right for the Executive to proceed with further easing of restrictions, including some indicative dates, to let people and businesses look ahead with greater optimism. As Health Minister, I support a strategic, holistic approach rather than a piecemeal process. For me, the guiding principle has to be the promotion of personal and societal well-being, prioritising the most difficult and challenging restrictions on a phased basis. That includes giving people more opportunities to meet up with family and friends outdoors in as safe a way as possible. And yes, for those staff members that I met this morning in the South Lake Vaccine Centre, and their asks, like many others, it should also mean getting back to the hairdressers and getting back to the barbers, as it should mean more businesses opening and considering even more people getting back to their caravans earlier than we'd have previously thought. To all those who have been bending my ear and making those asks, let me just say to them, I have listened to you and I hear you. I can confirm that my department has now fed into the central process, and whilst I will not preempt any decisions ahead of tomorrow's Executive, I do hope the agreed review will show clear signs of positivity and progress after it. But let me also add some notes of caution. Protecting our health service and those who depend on it and work for it is my job. I also owe it to the people of Northern Ireland to be straight with them. Easing any lockdown measure inevitably comes with some risk. Despite the success of our vaccination programme, as people mix more, the virus will spread more, and with all that may mean. That's how serious this still is. Against that, of course, we cannot stay in lockdown forever. That would be catastrophic for our society, not least in terms of our physical and mental well-being. So we have to remain careful and vigilant. We have to do our best to strike the correct balance, and that remains extremely difficult. It's a matter of public record that the Government Advisory Group SAGE has warned of a potential fresh COVID surge later in the year. Of course, we now have the COVID vaccines as our additional line of defence. It is essential that we maintain our momentum with our vaccination programme, so please get the jab when it's your turn, and encourage your friends and relatives to do the same. Vaccines are our best defence and shield against COVID. They do not provide a 100% protection, of course. They will and are doing more of the heavy lifting, but they cannot do it all. That's why SAGE is sounding that warning. The vaccination programme has some distance to go yet, and with the best will in the world, we will not achieve 100% take-up. Also, no vaccine ever gives total protection to all those who get it. That's why I have to strike those notes of caution amid the optimism and hope. We cannot abandon all restrictions in one go. We cannot lose the run of ourselves. We cannot see the good work undone. Effective adherence and enforcement measures will be absolutely essential if we are to keep the virus under control and diminish the potential for another significant surge. We also must not forget the life-saving lessons we have all learned this past year. Social distancing, wearing a mask, washing our hands, letting fresh air in and doing more outdoors. So it's safer to meet up in the great outdoors. We must make fresh air our friend and let our fresh air blow away those COVID particles. I'll now hand over to our Chief Medical Officer, Dr. Michael McBride.
Thank you, Minister. Good afternoon, everyone. Unfortunately, today we're reporting that another person has sadly died from COVID-19, and I want to take this opportunity to put on record my sorrow and regret and extend my condolences to the family and friends. As the Minister has said, we have made very significant progress since the dark days of winter. And that is thanks to the commitment of you, the general public, and the sacrifices by so many people and the dedication of health and care staff. While it is also down to the benefits of the vaccination programme, in the main, the impact that we have had, the reductions in infection that we have seen, have been down to the effectiveness of the lockdown, the measures we had in place, and the restrictions that you have lived with over many long months. Thank you. You have made a difference. You have helped us get this virus under control, and you have saved many, many lives. We now thankfully have some more headroom and an opportunity for some restrictions to be eased on a phased basis, as the Executive's pathway intended. I'm now going to take you through some slides to indicate the state of the epidemic here in Northern Ireland at this time. Here you can see the now familiar slide of the 7-day rolling average of new cases per day. There has been a modest increase in the daily average of new positive cases, and I think this may in part be due to a rebound effect following the Easter holidays, and we should see the full impact of that in next week's figures. We also need to bear in mind that the picture this week has been affected by recent changes in the pattern of social mixing, testing behaviour with the return of schools and then the closure of schools over the school holiday period, and also the Easter holidays. This is perhaps best illustrated in this slide, where we can see that the increase has occurred across all age groups, those 30 to 50, those 18 to 30 at the top, and also in those in the age 11 to 18. So significant increases across all age cohorts. And this demonstrates, as the Minister has said, the importance of all of us following the advice and limiting our contacts as much as possible. This slide shows the daily 7-day rolling average of test positivity. As we know by now, the figure, once we can keep that under 5%, we have the epidemic under control. And while testing has increased somewhat in the post-Easter period, the percentage of positive tests, as we can see here, remains approximately constant at around 2%. The latest ONS survey data has estimated that approximately 6,100 people in Northern Ireland have COVID-19. That's about 1 in 300 people. And I think it's important that we remember those statistics, and also remember that up to a third of us with COVID-19 will have no symptoms. This slide shows the incidence per 100,000 by local government districts. We have seen an increase in Derry, City and Strabane, Newry and Mourne, and to a lesser extent Causeway, Coast and Glens. I would like again to place on record my sincere thanks to the local government, to community partners, the Public Health Agency, who have been working in partnership with many community groups and networks in terms of the local response to clusters and outbreaks that have contributed to these rises. This slide shows the changing pattern across the common travel area, where the numbers are changing fairly rapidly. As we can see here, Northern Ireland is the middle blue bar. We have currently a higher incidence than Wales. We are similar to England, lower than Scotland and the Republic of Ireland. And as I said earlier, thanks to your efforts and to the beginnings of the impact of the vaccination programme, we have seen the number of COVID positive admissions to our hospitals continue to fall. And similarly, in the final slide, we have also now can see a sustained fall in people being admitted into intensive care. As the Minister has said, as we move steadily towards greater freedoms, let us all remain determined to use them wisely. As restrictions ease, a greater onus will fall on each and every one of us as individuals to keep following the public health advice, to do all in our power to stop the virus spreading, to work with the contact tracing service to break chains of infections. Please do not take unnecessary risks that have consequences for those who are close to you and consequences for everyone else. Please don't think that infection could never happen to you or those that matter to you. As restrictions ease, adherence to the advice and rules has never been more important. There are a range of possible outcomes in the weeks and months ahead, and where we end up depends on the decisions we make, what each of us does, and what we all do. We all know the drill by now. We know the actions we need to take. And just let me underline what the Minister said about the importance of fresh air and the great outdoors. COVID thrives best in enclosed indoor settings. Meeting up with people outdoors is safer and better for us. Limit your contact to those that matter most and make sure you keep each other safe. There is, however, another vital step for all of us to take to help limit the restrictions on our lives, and that's to get vaccinated. Get the jab when you're able to do so and when you are eligible to do so. Do not delay. Although vaccine supplies are limited this month, there are some slots still available for booking. So do it now. It's the right thing to do, and I ask you not to delay. This is our passport to better times. I know there will be some concerns, and while no medicine, no vaccine is without risk, the UK and EU regulators have again confirmed that these are safe and effective vaccines, and the benefits far outweigh any potential side effects for the vast majority of people. I believe vaccination has already saved hundreds of lives in Northern Ireland, and it will save more. So we need to maintain the momentum and get as many people vaccinated as soon as possible. I believe we're on the cusp of better, of happier times, and vaccination is central to getting us there. And what is also central to getting us there and keeping us there is for you all, as you have done over the last number of months, to follow the advice, follow the guidance, keep yourself, your family, those that matter to you, and the rest of us safe. Thank you.
Thank you, Michael. Mary-Louise Connolly, BBC.
Good to hear.
Sorry, Mary
I'm
Louise,
sure
you froze there. Sorry, we lost you at the start.
lost me in full flow. Well, good afternoon, everyone, and lots of positive news there. I'm sure I'm speaking on behalf of lots of people who are delighted to hear that we can put away the scissors and look forward to an appointment with a professional instead. What changed your mind, Minister? Because I know there was concern over pictures from England over the past couple of days where we saw lots of people out and about, eating in restaurants. Of course, they were outside, but people did seem to be very close together. We are going to start opening up again sooner, perhaps, than what most of us had thought. What has changed your mind over the past 48 hours?
Well, Mary Louise, it hasn't been so much over the past 48 hours, but in regards to where we've been observing the number of inpatients we've had due to COVID in hospitals, the number of people we have in ICU as well, our test positivity rates on the slides that Michael has went through earlier on in regards to that test positivity of the number of tests completed being below 5% for a considerable period of time. So it is about taking those proportionate steps. We've always said we wouldn't be date specific, so that is what has allowed us to move ahead of what could have been other potential dates that we had in mind or was in mind of some outside the executive or outside the Department of Health. It is able, it is possible to do this because of the behaviours and because of the support of the people of Northern Ireland following the restrictions and the guidance up until now, but also due to the people coming forward and taking the vaccine as well, because we are now seeing the knock-on positivity and the positive effects that vaccine is having. You know, look at the small number of care homes we are now supporting with COVID outbreaks. Look at the small number of those over 60s, over 70s now coming into our hospital system, those people who would have needed the most intensive of support. So it's about all those indicators moving in the right direction for us as a health service.
Minister, yesterday you delivered a stark warning about hospital waiting lists and the need for sustained investment. Behind the scenes, we know that work has been ongoing about how we can reboot services and rebuild the health service in Northern Ireland. Are you going to be the health minister who makes decisions, or are you going to be influenced by an election in about a year's time, for instance, to reassure the public that change is on the cards? You know, can you give me an example of 3 things even that might change over the next couple of months that are going to influence hospital waiting lists?
Mary Louise, you asked me for 3 things, almost like a Presbyterian minister's service. Then you're looking, because you always try to base through the three core themes and the 3 messages. Look, we've already
just three examples. That's
well,
all
look,
it takes,
we already have the Lagan Valley Elective Care Centre up and running ago. Now, if anybody had asked 14, 16 months ago, were we going to be able to do that, there'd have been all sorts of challenges put out. We were able to do it. It's up. It's running now. We'll be bringing forward our a review on recovery of cancer services, quite a detailed, quite a pointed piece of work, because we know that is an area that we need to concentrate after the last 12 months. But also the review of urgent and emergency care as the third one as well, in regards to the number of people coming forward to emergency departments as well, and how we manage them better through our systems. One of the things that we've seen through this pandemic, and I've said this, is the breaking down of those silos that we've seen, not just between trusts, but between primary care, secondary care, our hospital systems, and even community pharmacy and all our other parts of our health service. Those silos were never intentional, but what we've seen now is a removal of those dear colleague letters, to where professionals and those working in the health service now talk to each other, now interact with each other, and it's about using the best square footage of every part of our health service, and about using every professional that works in it, no matter at what level. You know, again, if anybody had said 14 months ago that we'd have seen surgeons travelling from Belfast to do complete operations in the SWA, you know, we would have been talking about 14-month consultations and engagements. We've seen that now. We've seen those people getting those operations. Those changes are happening already, not on large scale, but they are happening, and they're laying a firm foundation of the changes that need to come. Mary Louise, I have never looked to politics through the last 14 months. There is an election coming. I'm not going to use it to try and deflect to some of the decisions that I have to make. We know the changes that were recommended by Bengoa. We know the changes that were recommended in safe places and
Right time, right place.
Right time, right place, part of people. All those recommendations have been made. With 3 years of a hiatus where no decisions were made. It's now about getting on. It's about putting those action plans and about delivering what we need to do. One of the things that COVID has actually brought to the fore is how necessary all those recommendations, changes, were actually needed to be done. Now's not the time for another review or another programme. Now's the time to get on with it. I want to be the minister to do that. If it comes to challenging times at the next election because of decisions I've taken, so be it. Mark Mallet, UTV.
Yes, thank you. Hello, Minister. Hello, Chief Medical Officer. The lifting of restrictions and the success of the UK vaccine programme, many would say, is a chance to emerge from the pandemic. But the World Health Organization today said perhaps because it's not 100% sure that the world is going to find it, in its words, easy to vaccinate itself out of this pandemic. So the harsh reality is COVID is far from over. Minister, the indicative dates that the Executive will set tomorrow, what are we looking at? Are we talking about a haircut, a bit of shopping, the chance to have a few pints before we batten down the hatches once again?
Mark, I think it also made it clear in my opening address, and I've never done it from this podium, as preempt any of the decisions or any of the announcements made by the Executive. Those decisions and those announcements will be made by my colleagues tomorrow following the Executive meeting. We've fed in our recommendations as to what we believe is possible. Now, it does push the boundaries of some of the limitations that we would have liked to have went to, but we think now is the right time to do it. We've seen what's happening elsewhere. We've seen what's possible within our health service, what's possible because of the vaccine programme. And I think that's the message that I do want to come out from this podium today, is that if you are over 40, if you're in one of those eligible groups, please come forward today. Look to the booking systems, get booked in. Should it be through one of our regional centres? Should it be through your GP? Or should it be through community pharmacy? We're making vaccines as easy and as readily available to as many people in Northern Ireland as we can in the appropriate age levels and limits.
Picking up on that point for the second question, and indeed whether it's to you or to the Chief Medical Officer, on the vaccine programme, the bad press surrounding the AstraZeneca vaccine and with some concerns about the Johnson & Johnson vaccine. Of course, health officials will say that the benefits far outweigh the risks, but the feeling amongst members of the public and is that no one will accept a death from a rare blood clot possibly caused by a vaccine as in any way acceptable. Are you concerned that the bad press will impact the vaccine programme here? And indeed, will you roll out the same sort of trial that they're doing in England, where you could test the first dose of AstraZeneca, those that have had the first dose of that vaccine, with a second dose of a different vaccine?
Mark, one of the things that I've always taken guidance in regards to the deployment and usage of vaccine is that guidance that comes from MHRA, also the EMA and even the World Health Organizations, which are saying the benefits of our vaccine programme currently outweigh the risks in the cohorts that we're working. And that's why we always complement that recommendations coming from those organisations with the guidance that we receive from the Joint Committee on Vaccine and Immunisation. It's something we've always stuck by in the department. It's always something we've always followed, but as an executive, we've always taken that guidance as to when was the right time to vaccinate different cohorts and what was the right vaccines to use at that point. In regards to the trial and the mixing of different vaccines for second doses, I'll let Michael pick up on that one.
Yes, as Minister said, we will continue to be guided and advised by the MHRA, the JCVI in terms of the use of vaccines. That's been the approach throughout the UK, based on the evidence, based on the science, and there's a rigorous process in place through the Yellow Card scheme to record any side effects, potential side effects, or any adverse reactions to any drug or medicine. But you need to be very, very clear, no drug, no medicine, no vaccine without some risk. And what we are talking about here is extremely rare events. We know that COVID itself causes clots, and we're talking about potential risk and adverse effects. That has not yet been causally proven. So I think that what I would say throughout all of this, the public throughout the pandemic has been very measured, very balanced, very considered. They've got used to looking at the evidence and making informed judgments for themselves, and that's right and proper. And we will continue to put all of the evidence into the public domain. And what they can be assured of is the robustness of the measures that we have in place to determine the safety of all of these vaccines, and that we will not be found wanting, because we put the safety of people first before all else. And when we weigh the risks and the potential risks against benefit, The UK regulator, the European regulator, the WHO have clearly stated that for the vast majority of people, you should not delay, you should get the vaccine. In terms of mixing and matching vaccines, that is not recommended. We have no evidence at this time about the impact that that might have. So as I've said in the last week, if you've had whatever you've had with the first dose of your vaccine, you should complete the course, the same vaccine for your second dose. We have no evidence yet as to how beneficial or otherwise that mixing and matching might be, and we really need to be guided by the evidence, and it'll probably be through into the autumn before we have the output from those studies that are underway.
Tara McLaughlin, Cool FM.
Yes, good afternoon, gentlemen. I just want to pick up on that note of vaccines, and I suppose one way to allay the public's fear really would be to give the clear and transparent information. So can you confirm, have there been any cases of rare blood clots reported as a result of any COVID vaccines in Northern Ireland, and have there been any deaths associated with this?
Michael, do you want to?
Yeah, well, Tara, thank you for your question. What I can absolutely provide categorical assurance on is that any potential association with vaccination in terms of side effect or adverse reaction is reported to the MHRA. It would be premature for me to make any comment on individual cases that have been reported until those investigations have been completed. For this very point, we know that COVID itself significantly increases the risk of blood clots. We know that there have been reports of blood clots, very extremely rare cases of blood clots reported in association with these vaccines. That and those reports needs to be fully, rigorously investigated. And as we've demonstrated time and time again, the MHRA, the EMA will put all of that information into the public domain as soon as possible. We in Northern Ireland contribute fully to those processes because there is nothing more important than the safety of the public and to provide assurances to the public that those vaccines are safe. But I'm not going to comment on individual reports or cases that have been appeared in the media. That would not be appropriate.
Appreciate that, Chief Medical Officer, but there is an awful lot of fear among the public about blood clots and about vaccines, and I suppose in one way to try and allay those fears would be to give us the clear and transparent information. Can you confirm, has there been any cases of blood clots associated with COVID vaccines in Northern Ireland and any deaths? And
I think I've answered that question, Tara. All potential side effects, any potential adverse effect is reported to the MHRA for investigation, and that is the same in Northern Ireland as in all other parts of the UK. And what we should not do, any of us, either in terms of anything that I say or anyone else says or anything that's reported, cause undue concern in the eyes of the public. What we need to do is to put all of that information into the public domain, and I think you will have seen over the last couple of weeks that's exactly what has happened. The regulators, who are the experts, independent from government, put that information into the public domain, and any information from any potential cases in Northern Ireland will be included in that information, so the public can look at the totality of that and we can all make informed judgments and decisions.
Rebecca Black, PA.
Good afternoon all. Just following on vaccinations, what sort of level of vaccination reluctance is there? There doesn't be quite a few appeals to people to come out and get their vaccinations. Also, is there a delivery date for the Moderna jab, and will the next age group be called forward anytime soon?
Rebecca, I think what we have done, we've actually moved to the 40-year-old cohort and over. So we're actually in front of a number of other places in the United Kingdom. So we want to make sure that there is a majority of that new cohort who have just recently been at it come forward, either through the regional centres, the GPs, or community pharmacy. At our, I suppose, estimation at this minute in time, there isn't a large-scale reluctancy in regards to vaccines. There still is a confidence, there's still a recognition of the benefit that the vaccination programme actually brings. I visited a number of vaccine sites myself, in the sense of relief from the people who are there, not just getting first doses, but second doses is actually palpable. The emotion that is there of people seeing the benefits that the vaccine programme will actually bring. Our current estimates in Northern Ireland that we have vaccinated over 87% of our over 50s. So we want to make sure that we move down through each cohort efficiently and effectively. We recently opened our SSE Arena, which has increased our capacity immensely, and that's why we're continually putting out the promotion for those over 40 to make sure we get that cohort as fully covered before we move to another age group.
Okay, and sorry, Minister, just have you got a date for the delivery of the Moderna jab coming on stream?
Michael?
Yes, we anticipate to be receiving supplies of the Moderna vaccine next month. In the meantime, what we have done is we have achieved and secured additional supplies of the Pfizer vaccine so that we can get on with our first doses and indeed second doses of that. And as I say, we fully anticipate Moderna vaccine next month.
Okay, Laura Hogan, RTE? Not there.